Mpox is spreading. It has spread rapidly in the Democratic Republic of the Congo, is now spreading in parts of Asia and Europe. In Sweden, the first case has been discovered of the new variant of what was called Monkeypox, now called Mpox. Yesterday, the World Health Organization declared it to be an outbreak of international concern. Earlier today, Pakistan's health ministry has confirmed at least one case of the virus in a patient who has returned from the UAE, so clearly not directly from Central Africa. Provincial health authorities in Pakistan have reported that they've detected at least 3 cases. Now, that's obviously not a lot of people, but the medics say this strain of Mpox is pretty virulent, although they haven't yet calculated the R rate. But there are at least 36,000 cases across 15 African Union nations. There are therapeutics for this illness. There is a vaccine made by a company called Bavarian Nordic in Norway. There is a vaccine rollout program that has already existed in this country. It was actually halted back in the summer of 2023. So this is a known virus, not a novel one. But it seems as if there is a new variant that's rolling around a bit. Now, I'm not here to panic anyone. I'm not saying to go out and stock up on Lurol. I'm not ordering you to start pushing your 99-year-old granddad around the garden 100 times. But my show on LBC was the first show to talk about the worrying new strain of flu in China back in January 2020. And I said I was worried then. So I think we can all be slightly excused for sitting up a little bit straighter at the news that Mpox is moving at quite a lick, and the law of averages suggests it is very likely that cases will start to arrive in the UK. We've been on the phone today to the UK Health Security Agency, the new body set up in the wake of COVID to respond to viruses, diseases, global health monitoring. They've declined to do an interview, but we have a statement from them which says the risk to the UK population is currently considered low. However, planning is underway to prepare for any cases that we might see in the UK. This includes ensuring that clinicians are aware and able to recognise cases promptly, that rapid testing is available, and that protocols are developed for the safe clinical care of people who have the infection and the prevention of onward transmission. That last bit, the prevention of onward transmission, makes me shudder. This hour, I'd like calm, rational, thought-through explanations of what you think is coming, what you think can and should be done, whether you've got relatives in parts of Africa that are affected by this, where there are lots and lots of cases of this, what they are seeing and experiencing. 03456060973 if you have come back relatively recently from the DRC or Burundi or Rwanda or Uganda or Kenya. Have you been contacted? What happened at the airport when you came back? What should happen to people coming back to the UK from those countries? 03456060973 is the number. 5:08. Dr. Jonas Albarnaz is a fellow in virology at the Pirbright Institute, which aims to prevent and control viral diseases originating in animals. Thank you very much indeed for coming on. Just before we get into some of what has been discovered already in the past sort of 24 hours or so, tell us a little bit about Mpox, how it's spread, and what people can look for if they were to get a rash.
Oh, thank you for the invitation to be here. Monkeypox is a well-known virus for decades. So it was identified in the 1970s, and since then the cases in humans were always zoonotic. So they were linked to the acquisition of the virus directly from the animal reservoir, and that changed in 2022 when we started seeing this ongoing transmission between humans, and that everyone knows caused a global outbreak in several countries, which basically subsided now. But and this was caused by the what we call a clade 2 monkeypox virus, and this is known to cause a milder disease than the clade 1. The clade 1 monkeypox virus is known to be restricted to DRC so far. So there was an ongoing outbreak in 2023, and there was evidence that there was ongoing human-to-human transmission in DRC, but the virus had never been identified outside DRC. So that changed in the last few weeks when this new variant, this clade 1b variant, was identified in DRC and then subsequently identified in 3 or 4 other African countries. And now it was identified in Sweden as well. So this is a clade 1 virus, which is known to cause a more severe disease with a higher mortality rate. And so that's why it's concerning to have these cases in Europe and outside DRC.
So it's clade 1b variant that it has a higher mortality rate. And do we have any idea of what the R rate is, what the transmission rate is?
No, well, it's not only clade 1b that causes a higher, more severe disease and higher mortality. It's the clade 1 viruses overall, of which clade 1b is a variant
I see, yeah.
Well, there is no evidence so far about the R0, about the transmissibility of this virus, whether it differs from what we know about.
So what do we know about the sort of the clade overall rather than the clade 1b? What's the sort of general transmissibility of that?
Well, I don't know about a specific number, right. R0, but the transmissibility of clade 1 and clade 2 is not known to be different. What was different? So, as I said, it was zoonotic as we knew before, this virus was zoonotic, so humans were mostly an accidental host. And that changed over time, and the virus now seems to be transmitted pretty well between humans. But there is no difference that this human-to-human transmission is different between clade 2, clade 1, or clade 1b. This evidence is not there yet.
Fine. So we're seeing potentially the same amount of, or the same rate at which transmission is acquired even with a new variant, but this variant has a higher mortality rate.
The clade 1 virus has a higher mortality rate
I see.
than clade 2. Overall,
Gotcha.
We don't know whether the variant 1b is any different so far. There is no evidence. The only difference is that this case outside DRC is the clade 1b is the first to be identified outside DRC.
I'll put it to you, Dr. Albarnaz, that it is only a matter of time before monkeypox is detected in the UK and this variant is detected in the UK.
Well, that's hard to say. I think that's important. The fact that the virus has been identified in countries, other African countries outside DRC, in Sweden, and now you have just told about Pakistan, is a warning call for the health authorities to be vigilant. And that's essential to identify the cases early on, because contact tracing is important to highlight that transmission of monkeypox is via direct contact, so it's close contacts necessary. So contact tracing of tracing the contacts of eventual cases is essential to control the spread of this disease. So I think being vigilant is what is important at the moment.
I feel like I'm going to ask you a question that was asked a lot about 4 years ago. For people arriving into the UK from the places where monkeypox is happening, in higher numbers than, say, Pakistan or Sweden, so in countries like Burundi or Rwanda or Uganda, what do you think the UK authorities should be doing? Should they be testing them at the border? Should they be taking their details and contacting them about their time? Should they be offering them a vaccination because one exists?
Well, I think for anyone returning from countries where that is affected from this disease, now this clade 1 monkeypox virus, is important to be vigilant about any symptoms. So monkeypox virus causes flu-like symptoms to start with before any rash, skin rashes develop. So I think if these symptoms, if you return from these countries and you develop a symptom, I think contacting healthcare is the first action that I would do. Yeah.
And when you talk about a higher mortality rate, do we know what the mortality rate is?
Well, the mortality rate in DRC of the ongoing clade 1 outbreak that has been ongoing in DRC since last year is around 4%. So it varies between the age group. So it's more severe in young children than it is in adults. So there is a higher mortality rate, let's say around 7-8% in children than there is in younger adults. And that's known already. So it's well established that monkeypox infection causes a more severe disease in young children and pregnant women, and of course people that have a weakened immune system as well. And
it's spread by very close contact. I mean, the vaccination program that was rolled out in the UK up until June 2023 talked about the need to get the vaccine if you were, I think in one case, travelling to London or Greater Manchester to have sex, basically.
Yeah, well, the 2022 outbreak, the clade 2 outbreak from 2 years ago, that in the UK and most of the Western countries were being transmitted by close sexual contact. That was the main route of transmission. About the clade 1b, that also there is evidence that sexual networks are driving the spread from DRC to other African countries. So there is evidence that this is the driving route. But it's important to highlight that the ongoing outbreak of clade 1 in DRC is linked, is not only, there is household transmission as well. So it's not only via sexual encounters. Right. There is household transmission as well. But as I highlight that he requires a close contact. So it's necessary to have this close contact. And that's why sexual encounters are a common route of transmission.
Yeah. Really appreciate your time. Thank you very much indeed for coming on. Dr. Jonas Albarnaz, Fellow in Virology at the Pirbright Institute, which aims to prevent and control viral diseases originating in animals.